STRENSIQ, asfotase alfa, indication and important safety information, including boxed warning. Indication. What is STRENSIQ? STRENSIQ is a prescription medicine used to treat people with perinatal, infantile, and juvenile onset hypophosphatasia, HPP. Important safety information. What is the most important information I should know about STRENSIQ? STRENSIQ may cause serious side effects, including severe allergic hypersensitivity reactions. Allergic reactions are common with STRENSIQ treatment and can be severe and life-threatening. Severe allergic reactions have happened in some people within minutes after receiving STRENSIQ and more than 1 year after starting treatment with STRENSIQ. Stop using STRENSIQ and go to the nearest hospital emergency room right away if you or your loved one get any of the following signs and symptoms of a serious allergic reaction: difficulty breathing, choking sensation, swelling of your eyes, lips, or tongue, dizziness, nausea or vomiting, fever, headache, sweating, feeling irritable, chills, skin redness, skin rash or hives, itching or numbness of the tongue, lips, cheeks, or gums.
HPP hypophosphatasia has a definition of a body doesn't have enough alkaline phosphatase enzyme, and that can affect the deposition of calcium and phosphate in your bones and potentially can weaken your bones if you don't have enough of that enzyme.
I think it's been a gradual evolution from me advocating for him and me handling the communication about HPP and perhaps unconsciously teaching him by example. And now it has sort of phased into Quinn being the one to answer those questions.
Everyone's probably asked me, I always respond, I have a disease called hypophosphatasia. You can just call it soft bones. My bones are not as hard as yours, and I have some limitations, and that works for them.
It's part of you. So by sharing and by people, whoever you're sharing with, asking these questions and wanting to learn more, which inevitably happens, you are strengthening yourself.
Since Quinn has been old enough to even have a memory of anybody using the term hypophosphatasia or HPP, he has known that that is a condition that he has. So this is an awareness that he's really grown up with.
It's important to be clear and open. So if somebody asks me about, or if I'm talking to somebody about my HPP and my experiences with it and my symptoms, you have to have a certain degree of candor.
Most of the kids I've talked to about Quinn's condition just are curious. They need a very simple explanation in simple terms, such as soft bones or HPP.
I don't think I'm any different. I just think I'm a regular kid with some limitations.
What are the other possible side effects of STRENSIQ? STRENSIQ may cause other serious side effects, including skin thickening or pits at the injection site, lipodystrophy. Lipodystrophy is common and has happened after several months in people treated with STRENSIQ. Calcium buildup in the eyes and kidneys. People with HPP are at increased risk for developing calcium buildup in the body. Calcium buildup in the eyes and kidneys has happened and is a common side effect of STRENSIQ. Calcium buildup in the eyes and kidneys may also happen in people with HPP who are not treated with STRENSIQ. Your healthcare provider should check your eyes and kidneys before and during treatment with STRENSIQ. Immune-related effects. You may develop antibodies during treatment that may decrease how well STRENSIQ works. Tell your healthcare provider right away if you get worsening symptoms of HPP, including difficulty breathing, difficulty walking, feeling tired, bone pain, stiff joints, or loss of appetite. The most common side effects of STRENSIQ include local skin injection site reactions such as skin redness, bruising, color change, pain, itching, hardening of the skin, induration, swelling, and bumps. These are not all the possible side effects of STRENSIQ. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You will begin receiving STRENSIQ under the supervision of a healthcare provider. Tell your healthcare provider about all your medical conditions, including if you have had an allergic reaction to STRENSIQ, are pregnant or plan to become pregnant. It is not known if STRENSIQ will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if STRENSIQ passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you use STRENSIQ. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. There is a registry for people who use STRENSIQ. The purpose of this registry is to collect information about HPP and about what happens when you use STRENSIQ for a long time. For more information about this registry, talk with your healthcare provider or go to www.hppregistry.com. To report suspected side effects, contact Alexion Pharmaceuticals, Inc. at 1-844-259-6783 or FDA at 1-800-FDA-1088 or www.fda.gov/MedWatch. Please see full prescribing information and patient information for STRENSIQ asfotase alfa, including boxed warning regarding severe allergic hypersensitivity reactions at strensiq.com.